Moving over to Alberta, that province moved yesterday to lift many public health measures related to the pandemic. Now, at the same time, COVID-19 cases there in Alberta are on the rise. The chief medical officer says signs that the virus is rapidly spreading among the unvaccinated does not mean they will alter their plans.
We did not employ those public health measures to manage cases. We employed them to reduce the chances that our healthcare system would be overwhelmed.
Perhaps the biggest change will come in the next 3 weeks. Beginning August 16th, any Albertan who tests positive for COVID will no longer be required to isolate. So I'm going to repeat that. August 16th, anyone who tests positive for COVID-19 will no longer be required to isolate. This is in Alberta. So for more on this, our Chase team has reached Dr. Darren Markland. He's an ICU doctor and nephrologist, and he joins me live from Edmonton. Well, when you look at those measures, what does that say to you, doctor?
Quite honestly, what it tells me is that our government has decided that this is over. In fact, they've relabeled this. We now call it an endemic condition in Alberta. And I think our next step now will be to discontinue weather reports so that we can deal with wildfires and smoke.
Are you suggesting then that we are not in a post-pandemic phase? Because I've been hearing that expression over and over again.
Of course we're not. The world right now is suffering. Alberta is in a uniquely privileged position because we've had very good access to vaccines. But despite that, it's been heterogeneous uptake. We have areas in Alberta that have under 50% vaccination. And that's where the epidemics will happen, and they will filter down to tertiary hospitals and hamper our system. So if you have a heart attack or a difficult pregnancy, the same issues will exist, even though it will be less obvious because most people who are vaccinated will have less severe disease.
So describe the situation then. Help me to understand what is happening, for example, in your hospital when it comes to COVID-19 ICU cases. The burnout, if you will, for lack of a better word, of your staff, the trials and tribulations that you're going through, as you say, we are still in this pandemic.
We're feeling the same frustration, I think, as the general Alberta population. When people hear what's coming from our government, there is so much cognitive dissonance that people who are otherwise reasonable have lost trust, I think, in the public messaging. I have tried to take a very moderate stance in this. I think our vaccinations have reduced illnesses and severity. But I also don't want to fly blind through Delta because Delta is a different virus. It is highly infectious. It spreads before tests are positive. And there is breakthrough infections even in people who are vaccinated. And given how much it proliferates, these diseases spread from vaccinated individuals. Hence, masking is still required.
Yeah. You've got to admit, though, people are hitting that point where they're just tired of wearing a mask. They're tired of all the restrictions. Maybe businesses are feeling it as well. Are you suggesting that reopening businesses is being prioritized over the health of Albertans?
Businesses have never been closed in Alberta. They've modified their approach to doing things. What I'm suggesting is that a haphazard, swerving all over the road approach to the pandemic is what's frustrating people and hampering businesses. And that will continue to be a problem long after our pandemic is truly done with.
We've seen at least 84 cases from the Calgary Stampede so far. And now with these changes to mandatory quarantines, could that only add to the problem?
Good people will always do the right thing. The challenge now are people who truly believe the wrong information. So that's where moral leadership has always been important, and that's where our government has always been lacking. Without good leadership and enforcement of that, I do think that in combination with decreasing mask laws and a completely unvaccinated under 12 population, it's going to get us into trouble.
Yeah. So if the province then continues down this trajectory, I'm not asking you to bring out a crystal ball, but how do you see that playing out, the impact on where you work, the healthcare system?
It's not about me. I think the big issue here is we're operating under some very false premises. One, that this will always be with us. Coronavirus is not influenza. It will not always be with us. With vaccination and eventually this virus will go away. So to rush it is stupid. I think what we really need to do is rebuild faith in the medical system and governance, and that's a much bigger issue, because I think the point of this government has been to disrupt that relationship, and it's harmful.
So to rebuild faith, which means you're suggesting or saying people have lost faith?
People have lost trust.
Yeah.
Trust comes with evidence, consistency, feedback. I mean, if you're going to raise a kid well, you have to be consistent. Our government is raising psychopaths. And I don't mean that to be purgative, but I am saying that normal, respectful people are now confused. And as a result, we have vaccine hesitancy that's hurting us.
I want to thank you for your time, and perhaps we should check back, see how some of this comes to play out as your province continues to ease restrictions. You take care, Doctor.
Thank you very much. You as well.
Dr. Darren Markland is an intensive care doctor, and we reached him in Edmonton.